I'm Mark Grady. I'm a pediatric cardiologist. I've been here at Washington University in St. Louis and part of St. Louis Children's Hospital for probably about 30 years now. Ever since I finished medical school, I did my residency and fellowship training here. So I've been here a long time. Probably a little over 10 years ago or so, I became interested in pulmonary hypertension. We had sort of a small program at that time. We are also a center that does a lot of lung transplantation in children. In fact, probably the busiest pediatric lung transplant center in the world. And so that was one of the reasons why I became interested also in pulmonary hypertension, because we were getting a number of referrals to our center for possible lung transplants. So one of the things that here in St. Louis we've become interested in as part of the sort of armamentarium, if you will, to treat kids with pulmonary hypertension is this surgical procedure called a POTS shunt. We think that it holds a lot of promise in certain kids and providing them a much better quality of life than they had previously had. Traditionally, if you are diagnosed with pulmonary hypertension, currently there are a number of medications that one tries to try and slow down, or if you're lucky, even reverse the process. But unfortunately, as most people know, with pulmonary hypertension, that's not really a cure per se. You're just hoping to keep it from progressing. And then if it were to progress, there's not a lot of options out there aside from transplantation itself, it's a pretty big leap for a lot of kids and their families. And so this idea of maybe something surgically that's a little bit not as aggressive as transplantation that might have some benefit came into play. This idea of utilizing what's called a POTS shunt. It's named after a surgeon, Willis Potts, who lived in Chicago. He was a surgeon in the 1940s, and he developed this technique initially to help babies that were blue, that actually didn't have enough blood going to their lungs. The shunt basically involves connecting the pulmonary artery, which is the main artery coming out of the right side of the heart, to the aorta, which is the main vessel coming out of the left side of the heart. Because you make this connection, it allows blood to go from one side of the heart to the other fairly easily. And when it was first developed, it was again meant to help blood get into the lungs. This was back again in the 1940s. And since then, other surgical techniques sort of replaced the POTS shunt, so it fell sort of by the wayside. And it really wasn't until the early 2000s when the French group based in Paris had the really innovative idea of using this shunt to not provide extra blood into the lungs, but to actually allow blood to escape the lungs, because the pressures would get so high in somebody with pulmonary hypertension that the blood would have nowhere to go. And so this POTS shunt is sort of like a backdoor way for the blood to sort of escape. So not all of the blood has to be forced through those lungs that are having so much problems. That's more or less the concept, is that you're trying to reduce the pressure a bit in the right side of the heart from really high levels to less threatening levels. I mean, the French have been doing it for close to 15 years now, and they've had a number of kids, and we have now had a number of children as well, where clearly I think the shunt has a role. It can certainly make a child who's very symptomatic from their disease and is not getting better on really aggressive medications, and all of a sudden it makes them run around and look like a little kid again. But when do you use it? That's the interesting question. I think for the shunt to be most effective, it needs to be utilized in somebody whose heart is still functioning well, that the right side of the heart, the right ventricle, which is the one that has to push through those diseased lungs, that ventricle still has some oomph to it. Because if you wait too long, then the shunt's not going to help. If the right ventricle has started to fail, then you've waited too long. So I think the timing of when to place the shunt is something that we're continuing to explore. You can wait too long and then it won't be effective. And again, it's probably most effective in kids that have what we call super high right-sided pressures, where the right heart pressures are actually higher than the left. Normally, right heart pressures should be like a quarter of what the left is. But in kids with really bad pulmonary hypertension, it's actually higher than the left. And those are the ones that we feel like you should be thinking about a POTS shunt maybe. I have talked to some of my adult PH colleagues, and I just think that they're not as aware of the potential utility of this. I think a lot of doctors that treat adults with pulmonary hypertension tend to be pulmonologists. And I just think that they maybe don't think about plumbing the way a cardiologist like myself might think about it. And I also think that in the adult world, having really high pressures in the right side that makes the shunt successful is less common than it is in children. The procedure is not one that involves opening up the heart. The heart does not have to necessarily go on the heart-lung machine. The heart's not stopped as it would be, say, if you had a hole in your heart that needed to be repaired. So it can be done while the heart's beating. Traditionally, this shunt is placed through an incision along the side of the chest, although we have done it a few times from the front of the chest. Now, there are also kids that have had these shunts successfully placed in the cardiac catheterization lab. I know that we've done several of those, but it's sort of a unique child that has that opportunity to have a shunt placed in that manner. And that's obviously a lot less invasive than going through surgery. Some of the European groups have been more aggressive about utilizing a catheter-based approach to placing a POTS shunt. We're one of the leading pediatric lung transplant centers in the world, and so I'm involved with a lot of children that are referred to us for possible transplant. And as well as I think that we do it, it has some serious limitations, especially if you compare lung transplantation to other solid organs, it just doesn't do as well. And so even though I'm in the business of quote unquote selling transplants, I still feel like anything you can do to avoid a transplant is to your child's benefit. And I think that this POTS shunt has that potential. I think that anytime a child has really high pressures in their heart, especially if one is considering really aggressive medications like intravenous prostacyclins, I would like to think that the caregivers think about a POTS shunt and whether or not that might be applicable at some point in that child's treatment process. There's still some hesitation about acceptance about this procedure and maybe some skepticism about it, which I think is unfortunate because I do think that there's been enough data and there are kids now that are more than 10 years out from this procedure and clearly have done well. And I'm not saying it's a cure-all, but I do think that it should take its place alongside all the other ways that we have to treat children with pulmonary hypertension. It's nice that there's a forum such as this that allows a little bit more sort of awareness of it, which I think is the most important thing, just to think about it. I am Dr. Mark Grady, and I am aware that I'm rare.